my final lecture is on the disorders of male reproduction. So if you've remembered, first lecture cover photo was Selembu, which was made by a hybrid of Bosgorus hubaki and Bos indicus. So that's BG hubaki's sperm. So this is BG hubaki and Bos indicus oocyte. So this is I would say our native wild cattle that I think is struggling. So that's that. Topic today is on the male reproductive disorders. When I was doing this slide, I realized that if I were to teach reproductive disorders, it's actually a very big blanket to cover, especially if you go across species. So what I'm going to do, or what I did previously, was that I just listed down as many as possible, hopefully to be able to check the boxes of all the diseases or the disorders, so that at least we have touched once and you have heard of it once. But as I would suppose, as you practice and as you join rotation, you will be exposed further, and that would hopefully give you the best lesson lah, in terms of understanding disorders. And even for me, I think it comes with experience a lot of time. So similarly, I like to look at the disorders or the diseases based on the anatomy and function. So if the insult is happening at different region of the anatomy, it will affect different function of the physiology of the animal or the reproductive system. To recap, is that testes, accessory sex glands, and penis have all different functions. So in dogs, I think major ASG is the prostate. So if you're talking about disorders of the ASG, then that's the prostate. But of course, then the rest is quite similar in the sense that they have penis and prepuce, which will expose them to similar insult as bulls and sheep and other species. So then you can kind of see now there are at least species specific differences in terms of the ASG, but there are common pathology that you could actually kind of relate to across the species. So there's this long list of what dogs and cats have exposure or are more prevalent in. I can't remember how I summarized this initially, but I think dogs in general, male dogs, have more developed pathology, and then it's more detailed study. So sebab tu dia ada bila in terms of pathology tu dia ada nama-nama yang lebih spesifik, and then names that are more, we would say, developed in terms of nomenclature. It's not so in cats. So if for example, if you compare penis and prepuce, so cats are mostly revolving around their fur or their hair. So it has something to do with hair getting tangled in the penis and prepuce. But dogs, on the other hand, because of the os penis, then they may have fracture. And then they have CTVT, which cats doesn't. So I suppose if you're talking about differentials, then dogs, there's a slight longer list. So similarly with ASG, it's more focused on prostate, where else in cats, it's plus another glands. But list is still longer in dog. Scrotal contents was not mentioned in cats. So I don't know why. Maybe it's not so common. So it's more common in dogs. So they mentioned some neoplasia and some tumors. Not so much in cats. Small or missing testes. So cat have it, but only one. Just remember crypto kit. But there were longer lists in terms of dog, hypoplasia and atrophy. I think if you imagine, it could go laterally in cats, but it doesn't for some odd reason. Maybe it's underdiagnosed in the sense that cats are not so happy when you palpate the testes. Not saying that dogs are, but I guess dogs are more tolerant if you try to palpate, so maybe that's why we see more of that. Larger testes. So if you see small testes, that's a differential. If you see larger testes, that's differentials. But there's another addition for dogs, which is epididymal disease. So this list, as you can see, is kind of boring. But as you go into clinical years, I think hopefully you would find this useful when you come across some reproductive pathology in small animals. So that's like a quick checklist or a quick reference list if you're encountering. And I actually organize it based on anatomy so that hopefully when you see one, do know where to refer to. I'm not going to go even into detail because that's a long list, but yeah, know it's there and know that we've at some point discussed about it and compile it here. So in small ruminants, they've discovered different prevalence. So it's more on the testicular hypoplasia, which is more common, as well as atrophy and unilateral cryptorchidism, but quite low incidence of like 4%. So if you have like 100, if you have 100 sheep, is this a sheep or a goat? And let's say if you have 100 sheep in a herd and you only have 1 to 25, 1 to 35 ratio, so you have two buck, unless you're talking about the kid, right? So maybe then you'll be facing with more pathology, as you said. But usually kids are not meant for breeding. So even if they have bilateral testicular hypoplasia or atrophy or unilateral cryptorchidism, it does not matter so much because at the end of the day, it's going to end up in slaughterhouse. So that's production animal for you. Does not perform, will meet your maker. Hormone pathology. Did I discuss this? At least with female animals, they are in a way, if it's in production, they are very good because they can get pregnant and then they can calve or kids. Then you have calf or kids to sell. But male animal, you want to keep it as little as possible. So I was discussing with your senior yesterday. Keeping male in Malay term is like apa bela belawak hidup. So memang sebenarnya you tak nak bela jantan banyak-banyak. You would want to keep it at minimum. Jantan ni banyak-banyak pun masalah dia bergaduh lah kan. Dia luka, then you need to treat their wound, and then they're aggressive, they're going to injure your staff. So usually we want to keep the male to minimal. Macam orang Negeri Sembilan panggil dia berabe boreh ya. So usually it's the female that you want to focus in for production, for your feeding, for your management. Male, just do one job, just mate. So if that male does not, for whatever reason, perform, you cull. Common reproductive pathology in goats. Itulah yang tiga ni tadi. That paper, based on that paper. So this one is in bugs. So previously, or this one, I think the highlight was on CAE virus. So you need to bear in mind as well. Yeah, we've seen CAE recently in Malaysia. So I think it's something for you to look out if you have infertilities in your bucks. So from that paper also mentioned, aside from CAE, other disorders that are related to bucks, such as arthritis. And in pole goats, they have intersexes or hermaphrodites. as well as free Martinism. So this is the one that I was saying. Farmers say the goat is a lesbian, right? So intersexes are more common in pool goats. Pool goats are goats that doesn't have horn, so they do carry this kind of genetic linked, and as well as I think some chromosomal link disease, and this dominant, this recessive pool genes apparently carry this disease, this intersexes gene together with it, so it gets expressed, and then you have more hermaphrodites goats in which are pool. So basically, you don't want to mate pool father and pool mother together because both are recessive. They're more likely gonna produce intersexes. Again, intersexes may be fine, but if you are having female and you're planning to use it as replacement ewe, and maybe that's not a good idea to keep so much pool goats. And then you have chimeras, testicular degeneration, hyperplasia, the list goes on. And some diseases that you need to see that is endemic and also prevalent in Malaysia is FMD and paratuberculosis. So this excerpt was from the article previously. So more reports, but in different species, which is in bulls. So as I was saying, if you remember, the prepuce is like the dewlap thing, right? So it kind of it's saggy, it's loose skin, so it's exposed to wound, cuts, abrasions, and those stuff. So as you can see, not just the prepuce, scrotum as well, because it's hanging, not ideal. Maybe that's why elephant choose to keep their testes inside their body. So scrotal wound prevalence was 5.3%, as well as testicular degeneration. Scrotal torsion, not so high. So the highest is that scrotal wound. Around 50% were affected by one or more gross abnormalities of the reproductive organ. So I think if you count scrotal wound in it, so that's why it kind of built up to that. But not really. Scrotal wound is 5.3. So the distribution is quite even. Only testicular degeneration seems to be the highest. But upon postmortem examination. So for bulls, at least what I want you to remember is it's not the prostate that always do the evil deed in bull. In fact, it's the opposite. Prostate is the least developed ASG in bulls. Seminal vesicle is actually the more prominent glands, and that is the most probable gland that will be inflamed if it's bacterial infected, or if it's viral infected, or if it's inflamed for any reason. The part that is going to be affected mostly is the seminal vesicle, hence seminal vesiculitis. I notice students that I don't teach and highlight this point whenever we go and palpate bulls ASG, they tend to ask me about the prostate because I think in their mind it's more or less like small animals, or it's more or less like dogs. They're not larger size of dogs. They are bull, different species. So seminal vesicle is the glands that you want to remember. And actually there are 4 glands that if you want to remember in bull. That's the ampulla, seminal vesicle, prostate, and the corpus gland. So know that ampulla is that region where you want to stimulate for EE. Seminal vesicle is where it's mostly going to be inflamed. So when you do your rectal palpation in bull, you know what you're going to look at. You know what you're going to palpate in case of inflammation. It helps. I think theoretically, if you have that in mind, it helps. Because if you don't, you will be going in blind doing rectal palpation, and then you will ask me, Doctor, where is the prostate? Where else prostate is not a good landmark at all for bull rectal palpation. Opposite to that, ampulla and the divercation of ampulla should be the region that is mostly palpable and more likely be your landmark in that matter. common pathology, which we have encountered, scrotal hernia and penile fracture, as well as phimosis. So scrotal hernia that we've seen was in buck. We're not sure of any history prior to that, but what we've noticed is that the buck has three hind legs. Sebabnya testis dia tu terjatuh sampai ke lantai, then we like actually it's the testis lah. It's the scrotum that actually descend because it's filled with small intestine. It gets heavy and it starts to drag on the floor. Can you imagine? So sebab tu I call the bug the five-legged bug. Sebab belakang dia tu ada ni kan. Yeah, but that's a sight lah, but that's not pleasing at all. Pinna fracture we encountered in raccoon. It got stuck, tangled in, I think they were using some sort of fleece or some sort of beddings, and then raccoon being raccoon, I think those have high libidos or whatnot. So they were, I think they were humping the towel and then they got stuck and then panic, then fracture the penis. Phimosis and paraphimosis we saw in bull, but it was exceptionally dirty. The feces content, I think, was about hoof length, so about this length. So actually the bull has nowhere possible for it to sit at all, and if it does, it's going to be swimming in feces, fecal material. So that's why we saw phimosis. Not really, nak kata apa, not really CSI work. So you come and see, you already know, hello, mister, your farm is so dirty. So this one has actually been published. I did not update this. I think it's in MJVM, Malaysian Journal of Veterinary Medicine, which is VAM's journal. So this was the five-legged bug I was saying, with the fifth testicular legs. Be very careful. When we saw this, our immediate thing was, let's drain the pus. When we start, initially it bleeds because we did ultrasound and everything and we couldn't put it in place. What is this thing? So we're thinking, well, maybe it's scar tissue, maybe it's along those lines. So let's drain the pus. Knowing that if it's small intestine field, you try to drain the pus, you cut some very big vein or artery, animal gonna bleed to death. So be very careful. I think that's a lesson that we all had to learn the hard way, and hopefully you don't have to. When you see this, immediately think of hernia, look for the hernia ring, and then after that, just repair the hernia ring. Don't be like us. We try to reduce it. We try to make apa yang kononnya nak ada pocket lah apa kan, try to reduce the ni and remove the pus, but actually it's not. So the consistency at this point, actually it does not feel like intestines, but we thought it was fibrous tissue. When we palpate and it's very compact. It's not like if you imagine if you palpate small intestine, it will follow kan. So it does not. I think it's about, there's a lot of small intestine already accumulate there over time. So dia dah sangat padat. So that's why we thought it was scar tissue and pus, but apparently it's small intestine. If we made the wrong cut, the bug would have died. But luckily enough, when we saw the blood, we were like, this is something else. There's an active blood vessels here. So we just made like a nick, and we realized that this is highly vascularized. We couldn't visualize at that moment of time that it was small intestine yet, because I think it's true that some part of that is still complicated with fibrous tissue. So macam dia tercover sikit demi small intestine. So that was, yeah. I think that was very valuable lesson that I want you guys to at least know and remember. So risk factor is the looseness of the prepuce, as I was saying, it's dangly, it's loose skin, and then distance between cranial preputial muscles and opening. I don't know what this means. Maybe you can, I know, but I forgot. Maybe if you want to know what it is, but that is what it is. length of prepuce, depending on tropical and non-tropical breed, length and size of umbilical remnants. So that's still some part of that near the upper pinna punya tu, and preputial muscle development. So yeah, some breed, especially non-tropical breed, the muscle is not so developed. So I rasa dia punya ni tak berapa pandai nak tarik bila dia ni sangkut pagar dan sebagainya. So this is the penis in tiger, which is barb. If you see like small cuticle layer that forms like the thorny part, tiger's penis. Oh, sorry, lion's penis. Similarly, along the felid family, they have that. So do not take it as a reproductive pathology lah. This was the os penis fracture on the raccoon that we did we did partial penectomy. So that's like cutting half of it and we like close it down. So if you're interested, I would encourage you to look at this website, Visual Guides of Animal Reproduction, to explore more on the bovine aspect. They have bovine, they have caprine and cervine. Sorry, not cervine. Bovine, caprine, and ovine reproduction. So it's just like online library of atlas, so that you can see what are the pathology you're interested in, or if you ever encountered with one. So that's all. Oi. That we have some time for the Kahoot, and also later maybe if you have some question, and we can probably revisit that. Bora. Oh, so if some of you have not installed Kahoot, please do. Ish. Sekarang dia bagi jawapan ni. Bahaya ni. Oh, kena stop sharing ya. Enter ya. Apa ni? Malam tak ada benda ni. Play live game. Dia boleh bagi 10 orang yang main. You have read the fine detail, huh? Hold on. Is that like Kahoot Premium if you want to play with big crowd? Malam test main sorang-sorang. Juga Kahoot ni buat duit. Right, in that case, I'm gonna let, apparently only the first 10 is gonna be privilege enough for that bonus ataupun that marks get out of jail card. So siapa yang cepat lah 10 orang je, but the rest of you could actually could actually join the session so that we can learn together. Right, so that's that. It's the pin. Tell me when you're ready. Kena letak nama betul lah, nanti macam mana nak bagi markah. I don't want to, can you guys put your full name? Because Yeah. So I'm gonna no no not even metric number. Boleh dah masuk 11 dah ni. So cuba korang masuk je. Boleh lah ni lebih dari 10. Ke, jadi tiba-tiba nak play dia kata go premium. Masam. Tak apalah, kita cuba je. Kalau tiba-tiba dia kata go premium, dan kita tengoklah who's the lucky 10. Who's 11? Is that a real name? Oh yeah, I think early reminder or early warning is that the setting in my Kahoot for all the questions are very fast. So it was meant to be that way. So you need to read fast and you need to answer fast based on your reflex. I only give 10 seconds. I don't even know how is that breakdown. Is it like 5 second read questions and 5 second to answer? But yeah, you need to be fast. So sebab tu kalau internet you memang tak bagus, tak boleh ni, then sorry. Is that all? I think it's more or less. How many in the class? Now we know the real attendance.
About 114.
114 ke 140? 140, 114?
114.
114, right. So there are 10% mortality. Actually, that's about right, you know. Actually, they expected 10% of mortality, especially if you go clinical years. Either they repeat or either they quit that program. Because my class was, I think we started with 90 something. By DVM 5, it was 80. So around that number. And actually, if you see the attendance as well, I think it's quite evidence. For whatever reason, they cannot commit kan. Dia tak minat ke. So sebab tu memang I rasa 10% mortality is expected. So I'm gonna start ya. Yang dah mati pula. Yang dah tak ada tu tak ada lah. Yang tak ada tu kira dah mortality rate lah tu. Okay tu 2 3. Okay, sorry. Can you see the browser clearly now. Maksudnya tak ada kacauan sebab now I see your faces. So I'm assuming you can't see those. So it's uninterrupted. Is that okay, Ravinia? Okay. So 1, 2, 3. Lock this game to prevent more players from joining. Oh, okay lah. So I lock lah. 99. Oh, semua boleh main lah. Oh, apparently not many. Yeah, so actually I've said this again and again, and even if you notice our first lecture pun actually is a hybrid of BG Hubaki and B Indicus, but still so many still think it's Indicus and Taurus. So at least get yourself corrected. Selembu is seladang dengan lembu. Kalau ni nombor 2 ni lembu dengan lembu. Kan? So dia akan jadi lembubu. Dia tak jadi selembu. Okay. See the scoreboard. Oh, Maria. Maria Amalia. Siapakah? It's yeah. Hmm. Hmm. Lecture pun Therio, tapi jawab BCS. Macam yeah, I mean if macam mana nak kata you can do it in a crush, but since it's a Therio subject, my focus will be on the reproductive tract. Selalunya yang BCS ni orang lain yang buat. So kalau you adalah vet Therio, you akan tengok reproductive tract in detail lah. Sebab tu dia punya keyword is in detail. So BCS ni selalunya kita orang awal-awal bila dia nak masuk yard, sebelum masuk crush, masa dia tengah grazing pun dia boleh tengok. Tak sempat baca semua jawapan. Sebab tu dia rasa you kena baca lebih laju. Maria dah turun. Mira sedang leading. So Maria salah. I think the question is reflects sebab tu dia I meant it to do fast. So kalau you sebenarnya tak tahu kalau you so sebenarnya tak tahu. I don't think I hope your reading unless you dyslexic a little bit like me, I hope you should not have some problem with reading. And it's a short sentence. I hope it's not due to that. So 1 to 20 is the right answer for bull. 1 to 35 that I mentioned earlier was in buck. So that don't mean to trick you guys. 2 to 30 is in deer. Because I said specifically deer stack, dia tak suka seko, dia sangat panik. So dia kena ada kawan. Sebab tu ratio I specific 2 to 30 at least. 1 to 25. Ingatlah. Siapa lah 1 ke 25 ni? Any of you guys remember? Tiba-tiba ada quiz dalam quiz. Swine. Is that true though? Dan Natasha kata swine. Betul tak?
Dalam lecture doktor.
Okay. So kalau swine 1 ke 25, sebenarnya memang sebab itulah swine dia lebih, I rasa dia lebih economical ataupun it's more sensible if you use AI. Sebab if you remember when we discussed yesterday, the semen volume for swine is 250 mil. So kalau you suruh dia servis sendiri, dia boleh servis 25. Lepas tu dia dah letih ke, penat ke kan, nak tidur kan. Tapi kalau you AI dia 250 mil, satu straw tu 0.25 mil. So kalau you tak extend pun 250 mil tu, let's see how many straw can you inseminate a day. So 250 bagi 0.25. 0.25 tu volume mil straw. 1,000. Boleh buat 1,000 straw. You can inseminate 1,000 straw per ejaculate. If compare to yang ni tak si bulan sebab dia per ejaculate. Yang ni 25 ni dia 25 ejaculate. So you kena kali 25 lagi. So that equal ejaculation, let's say in a day ke, or maybe not in a day mampu kan babi you. Kalau anyway, if it's 1 to 25, dia boleh, kalau AI you boleh pakai 25,000 ekor sebab dah ada 25,000. Oh, sorry. Dia tak pakai straw lah kalau babi. Babi dia pakai tu kan, dia pakai tube tu kan, betul dia pusing-pusing that corkscrew tube kan. Silap. So tube tu berapa mil lah? Korang pernah pergi ladang babi? Ladang khinzir. Kan cakap babi marah pula. Macam lah cakap timah marah. Tak pernah. Korang tak pernah pergi langsung lah. Oh, anyway, they use a tube macam Belcrim punya gel, Belcrim punya cream tu kan. So dia macam bentuk tu, lepas tu dia ada corkscrew punya corkscrew actually matches the cervix of this apa sow. So dia macam pusing sikit. So dia lock dekat dalam cervix tu. So dia biar dia letak dia macam toothpaste lah. Letak dekat belakang babi tu. Belakang sow tu. So dia akan slowly masuk. So kalau macam tu dia bukan 0.25 silap. So kalau dia 250, let's say satu tu rasa banyak dia letak tu. Let's say satu tu 10 mil. Okay, 10 mil. So bagi 10, 250 mil, 25 ekor. Okay. So 25 ekor, darab 25 ejaculate. So you dapat 625 tube. Still more lah. So I think this is where I'm getting at. Now, in terms of numbers, you still have more numbers that you can accommodate using AI. Ini sebab tak extend lagi. I tak tahulah, maybe babi punya bore punya semen tak perlu extend kot sebab dia memang diluted kan. So kita selalu extend sebab dia sikit dan dia pekat. So kita nak guna banyak. So kalau bore mungkin tak perlu dilute lagi. Kalau tak silap I dulu I pergi ladang pun dia collect semen daripada bore tu ejaculate kan. In that case memang dia biar first fraction tu macam dia biar lepas babi tu duduk panjat patung tu ada kencing saw lah. Dia panjat tu dia ejaculate lama dia macam. Lepas tu dia macam biar macam I macam dia dah ni lah cepatlah, tapi dia macam nanti tunggu dia nak ambil second version kan. So kita tunggulah. Habis tu duduk ejaculate. Rasa mungkin dalam 5 minit. Macam okay, kita ambil sekarang. So ambil sekarang tu pun dia pergi kan, dia tarik penis bawah tu, lepas tu dia pegang kejap apa. Rasa mungkin dalam 2 minit dah penuh satu beaker lah. Lepas tu macam okay, that was easy, no sweat. Bawah tu pun mungkin dah pandai lah. So dia ambil, dia pergi lab tengok bawah mikroskop, simulation. Orang Myanmar dia pun buat, bukan vet dia pun. Dia punya macam vet technician ni kan. Cakap Melayu pun macam tu lah sikit-sikit je macam. Tunggu. Okay. Boleh? Tak boleh? Itu je. So, dia tengok ada mikroskop dia dah ada yang siap ada ni kan. Siap ada yang pancarkan kepada skrin tu. So, kita tengok ramai-ramai dia punya motility apa semua. Memang cantik. Lepas tu dia daripada tube tu dia masukkan dekat dalam the tube tu. Macam tube ubat gigi tu. Masuk. Lepas tu mungkin ada dalam 10 ke. Bawa pergi kat saw. Saw ni selalu dia pakai bore untuk heat detect kan. So dia ada macam ada satu jalan yang panjang tu saw kan, kiri kanan kan. So bore tu akan jalan buat inspection kan. Kalau dia saw tu on heat, dia pergi dekat saw tu dia so farmer tu nampak, dia tanda okay yang ni nak kena AI lah lepas ni. Lepas tu jalan lagi, bore jalan, lepas tu dia tanda lagi ni nak kena AI. Dia tahulah masa tu nak AI kan. So dia bawa semen tu pun dia pergi terus lah, dia tujulah kepada bore yang stress tu. That was how they do it in swine, if I remember it well. So if you have if you have this amount, let's say, even throughout a period of, let's say, a breeding period of like 1 week or 2 weeks, it's still a lot better that the boar can serve if you do AI. It makes a lot of economical sense to use boar for AI. Yep. I think some people are commenting. I don't know how to see the chat. Sebabnya saya punya ni bila saya dah share screen ni dia dah degil. So saya nampak sekejap-sekejap macam tu hilang. So maybe we can go back to the chat later and continue with the ada ataupun ada orang nak tolong bacakan komen tu. I tak boleh tengok lah. Are there any interesting comment? Maybe Ravinia become the moderator and help me pick some comments if you want to discuss. Since we are at this point kan, kalau pergi tempat lain nanti lupa pula. Kan dah teringat nasi lemak, dah teringat donat kan, susah lah. Yang best tak Ravinia? Tak best kita.
Tak tahu sebab tak pandai baca. I mean, Fatia kata macam dah campuran lain dalam tube sebab macam warna dia cair dalam tube tu dalam 90 to 100 ml.
Satu tip tu Oh, banyak lah pula. Lari lah pula calculation kita. So kalau 100, satu sikit lah pula.
You.
Oh, so sebab tu dia kena extend balik. Dan dia kata dia macam cair tu. Oh, okay. Tak ingat lah. Ada extender lagi lah, tak ingat lah. Okay, have a point there. So if total ejaculate is 250 ml, if they're using 100 ml, yeah. I suppose it makes sense to extend. Selalu extend kalau babi. Selalu kalau lembu, selalunya kita extend daripada, let's say 1000. Kita extend dalam 10 factor of dilution. So if you have 250 ml, you times 10, factor of 10, you dapat 2500 ml, 2.5 liter. So you satu tube 100 ml lah. Satu tube 100 ml. Then you dapat 25 tube per ejaculate bull tu, bore tu. Per ejaculate. Yeah, so I think it still make a lot of sense lah. So it's at least 1 to 25 more efficient. Yeah, so at least it's more logical now. Tak adalah 600,000 juta billion. So okay, yeah. Sebab tu lah kalau tengok ladang babi pun dia ada 4 ke 5 ekor je bore. So sebab tu lah dia perlukan banyak juga. Maksudnya dia kena ada 4-5 ekor. Lepas tu sow dia, ratio dia, I tak ingat lah. Kalau AI memang tak silap I, 5 ekor bore tu ada, kalau tak silap, kalau tak 500, 600, 1000. Maksudnya dia punya jumlah sow tu. Guna 5 ekor je. Rasa ada, kalau tidak 1600 lah minimum. So 600 dengan 5 ekor. I ingat bore dia sebab bila I masuk farm tu kat Yenhe, farm tu ada 5 ekor bore yang diletak kat depan. So babi-babi handsome ni kat depan, yang Duroc dia, Landrace dia kat depan. Lalu lah, tiap pagi lalu lah jumpa dia orang. So kalau 5 ekor, let's say 600. Ni yang farm fully AI. So dia punya ratio 0.0833. 0.00833. So kalau 1 per 25, 0.04. So titik perpuluhan telah berpindah sebanyak berapa ni? 0.04 kepada 0.008. Satu titik perpuluhan. So dia punya ratio tu dah sangat kecil lah sebenarnya. Sangat besar lah. Kenapa dia tak bagi ratio tu lah, dia bagi 0.008. Tak berapa bijak lah nak tukar pagi-pagi ni. Anyway, you know, it's at least 10 times of that, so maybe 1/50 around there. No, it's 1/250. Because it's titik perpuluhan. Yeah, so around there lah. Kalau you pakai AI, I think that's around the ratio. It's not going to be 1 to 25 anymore. This is natural mating. Okay, at least we got that out of the way. If you guys are ready, I'm going to move on to the next question. I'm going to count 1, 2, 3. Starting from 1, 2, 3. Alah, rupanya dia bagi skor. Maria telah membuat satu comeback yang sangat bagus. 1, 2, 3. Hmm. 3 orang je yang betul. Ish. 3 orang yang betul ni pun mungkin teka je. Lah. So testosterone is not Sertoli, it's Leydig cells. So Sertoli is inhibin B, which is precursor by FSH. And it actually is a reverse feedback mechanism to testosterone. In a way, it controls the testosterone, and that is function of the Sertoli cells. In general, if you want to summarize the function of testis, yes, it's spermatogenesis, but that is not truly the function of Sertoli cells. Maybe some degree, but not major. So major is that protein which it secretes. Surprise, surprise. Let's see if the Game of Thrones changes. Sajida tiba-tiba dengan sangat performnya telah meneka ataupun telah menjawab dengan betul. 1, 2, 3. Ada juga yang jawab Bombay Stock Exchange. Ya Allah. Salah kelas lah. Minta maaf lah kawan. Yeah, so I think it's almost equal that some of you get confused over the terminology or the terms or the nomenclature. It's actually breeding soundness evaluation. Juga yang rasa dia BSE. Betul juga orang pakai BSE for bovine spongiform encephalitis, but sorry lah lecture yang salah. Bombay Stock Exchange pun kalau you Google dia keluar. So I pun macam, oh, letak je lah. Loh, Chihi! Sajida, sorry. Sajida masih leading. Dashini and Lim Jae-hui and Florence. You never know, sometimes nanti dia akan berubah. I don't know why my wife answered this wrong as well. And she answered measuring the diameter juga. But I told her like, but we're measuring the circumference. Do you know what circumference means? Circumference is ukulele. So you ukulele luar. Apa you nak measure diameter? Diameter is this, right? So radius is half the diameter. So maybe lah matematik dah lupa ke ataupun dah lupa kan. But it's actually the circumference. And when you measure testis, you want to measure it at the widest point. So if you imagine it's not the neck of the testis where it's quite narrow, you go at the widest point at the body of the testis. Oh, Sajida memang tak boleh tapau lah ni, dah jauh. 1, 2, 3. 33 adalah Bos Indicus. So if KK, it's 22.5. Yeah, this is a gen number that you need to remember lah if you're doing BSE later. Lim Jae-hui, wah, berjaya merampas tahta. I have to admit my math is not A plus, but this is basic mathematics, but perhaps under pressure, some of you have unable to answer this question. Good, Raja, well done. Berjaya mencapai podium. Ong Hui and Aiman. So some have dropped. I think Mira dah turun. Tadi siapa? Tak ingat. Dah turun juga, dah tak nampak lah. Well done. Life percentage and not the classification in terms of abnormalities. It's life or death. So yeah, good point here is that when you evaluate life or death, it's regardless of the abnormalities. You're just looking at what the number of sperm which are stained red or number of sperm that is unstained, regardless of the abnormalities. So you don't confuse yourself. Don't count abnormalities, tapi dok kira you can't do two things at once. So separate this. Life is just life. Abnormalities is just abnormalities, and abnormalities usually they use primary or secondary. They may use another one is major or minor abnormalities. So those are the two classifications that are usually used for sperm abnormalities. Sajida powernya telah berjaya merampas tata daripada Lim Chia Hui. Ini soalan bocor kot. Tak jawab prostatitis. Selalunya orang jawab prostatitis ni memang akan kena teruk-teruk lah dengan I time rota. Memang I targetnya. Cukup-cukup. So yeah, remember it's similar vesicleitis if it's in bulls. If it's in dogs, yeah. So that's all. Let's see the final podium. Ui. Raja, power. See? At least from opening the video, Raja has managed to secure number 3. Runner up Maria and 198553 something. So who is Sajida and Lim Chia Hui? Can I see your faces? Stop sharing now. Right. Can I see Sajida and Lim Chia Hui? Mana? Boleh buka video? Dengan Raja sebab dia dah buka. Menyapan ni memang dia dah buka video, so I kenal lah. Mana Lim Chia Hui and Sajida? Respon pun. Adakah mereka mempunyai sebarang kerusakan teknikal? Sajida, oh macam familiar. Chia Hui ada, mana Chia Hui? Oh sorry, Chia Hui tersorok di belakang kamera saya. Yang besar gedabak ni, sebab saya pakai DSLR as a webcam. So, oh, tak nampak lah. Can you come closer? Lim Chia Hui. Do you have an English name? No, you don't have. So just Lim Chia Hui. But you look familiar. Do I know you? Maybe not. Are you? Oh, apa dia?
No.
Tak kenal. Okay. Tak kenal. Okay, thank you very much. That's all the time we have today. Thank you for cooperating. Thank you for volunteering. I think May Yapan Raja Ravinia has been almost my loyal supporter in that sense. Dah left dah. Belum habis cakap lagi. There's a Malay terms for this. That apa? Professor Syed Taufik Al-Atas say. But he was saying that in terms of apa the arak yang timah tu kan. Yeah, but he's saying that we tidak apa tidak beradab bila macam tu. Maksudnya ini pun sama lah. Ini adalah satu perbuatan yang tidak beradab bila maksudnya ada kelas. I'm trying to conclude. Lepas tu you keluar. For whatever reason, I think itu kurang beradab. But anyway, apart from that, thank you very much. I enjoyed spending time with you. Enjoyed spending time giving lectures and sharing experience with you. I learned as much as you do. So I'm looking forward to see all of you guys during Therio rotation, and all the best for your tests and exam. Take care. I'm using 2 devices in class. So your lecturer is next to me now. She's gonna use the same laptop. So before I finish next time, or before any lecturer finish next time, please wait until they finish. And Webex is gonna tell me the attendance who exit earlier. And next time when I see you in rotation, be extra prepared. Thank you. Bye.
Thank you, Doctor.
Thank you,
You're welcome.
Doctor.
Bye.
Doctor.
Doctor.